All right, welcome back, everybody. I hope you all are doing well. We are going to continue our lecture series. Now we're going to focus on antipsychotics. These are also called neuroleptics. Now, as I mentioned previously in videos before, this is just going to be a brief overview of this. There's so much more detail that we can go into, but in general, when you think about antipsychotic medication, you should think of the mesolimbic pathway. And so what antipsychotics are doing is that they're decreasing the excess of dopamine that is typically associated with perhaps schizophrenia. And so that's kind of what you can kind of think about, is that antipsychotics are decreasing the excess dopamine activity in this mesolimbic pathway. And by doing so, it's reducing a lot of the psychosis that could occur from certain disorders. Now, some behavioral signs of psychosis. How do you know that someone is either having a psychotic episode or going through some level of psychosis? If they have a difficulty discerning reality, that's always usually a good sign. If there's increased feelings of paranoia, uneasiness, or even unusual disinterest or intense engagement in certain activities, okay? So let me give you a little bit of another look at the mesolimbic pathway, and you can kind of see that from different angles in terms of what's happening. So as you can imagine, this is a really important level and system of the body, always associated with psychosis, with an excessive amount of dopamine in the brain. And what these antipsychotics are doing is that they're trying to reduce that level of dopamine within the brain. Okay, so let's go at this from a neuron perspective. This is where, imagine what you want to do with any of these medications. What you hope that they're doing is that you hope that they're reducing in some way the excess amount of neurotransmitter dopamine in the mesolimbic pathway. So how exactly are they doing that? You can kind of see the rush or the flow of dopamine from the presynaptic cleft all the way into the synapse, and then binding on to the receptors, the dopamine receptors, into the postsynaptic cleft. So how exactly is this medication going to work? So what you're essentially going to do is that the antipsychotic medications are going to decrease dopamine signaling in the mesolimbic pathway. And the way that they're doing that is that they're blocking these dopamine receptors. All right, so let's see if we can go forward a little bit. So what these antipsychotic medications are doing, they're binding on to these receptors. They're blocking dopamine from binding on to these receptors. In terms of doing that, what they're essentially doing is that they're modulating the dopamine activity in the pathway, which is therefore relieving psychotic symptoms from happening, right? So the more that you block dopamine is prevented from actually binding on to the neuron and kind of correlating with some of the psychotic effects. Now, you can imagine if you're going to block dopamine, there's going to be some side effects that could happen. And some of the side effects from antipsychotic medications could include decreased motor control, body tremors, constipation, or just feeling very lethargic. Now, imagine dopamine is a very important neurotransmitter in terms of pleasure and motivating yourself to do something. Yeah, you can imagine some type of reward pathway that happens from dopamine. So in terms of blocking that, you're essentially reducing the hyperactivity that is typically involved with dopamine. And some of the side effects, as I mentioned, could include being more lethargic than normal, and then some of the body tremors or some of the movement disorientation disorders that perhaps could happen from that. What is going to happen whenever you perhaps refer a patient to a psychiatrist or a medical provider? They're going to really take a specific look at the dosage of that antipsychotic medication in order to hopefully reduce some of those side effects and to manage those patients' symptoms even better. There's a few levels of antipsychotic medications. There's the traditional antipsychotics, mostly targeting dopamine receptors, and then there's the novel or antipsychotic medications that's working on dopamine as well as serotonin. So we won't go into the details of that, but I just wanted to give you a little bit of an overview in terms of what's happening. All right, so that ends our discussion lecture series on antipsychotic medication. Next, we're going to talk about antidepressive medications.